Hello, ladies and gentlemen. My name is Jesus Manuel Rosario Claudio, third year student from the University of Puerto Rico at Calle, and today I'll be presenting my proposal titled Association of White Matter Integrity with Salivary Cortisol Levels and Depression Severity in Women. My mentor for this project was Ms. Charlene Rivera Bonet, and our PI was Dr. Heather Abercrombie. Our hypothesis is that a relationship exists between depression severity, cortisol levels, especially salivary cortisol levels, and fractional anisotropy values in patients with depression. Being more specific, the higher the severity of the depression, the higher the salivary cortisol levels, and the more fractional anisotropy dysregulations patients with depression will experience. Our aims for this project proposal include to determine the correlation between severity of the depression and salivary cortisol levels, to determine the correlation between salivary cortisol levels and fractional anisotropy values, and to determine the correlation between depression severity and fractional anisotropy values. In this project proposal, we will analyze the relationship between depression severity, salivary cortisol levels, and white matter integrity in women with depression and healthy controls using techniques such as Beck Depression Inventory, saliva cortisol tests, diffusion tensor imaging, and tract-based spatial statistics. Investigating the effects of depression severity and salivary cortisol levels on white matter integrity will allow us to shed light on the mechanisms of depression, which in the future could lead to identifying potential treatment targets. Depression is a common and serious medical illness that negatively affects how you feel, think, and act. It has many symptoms that can vary from mild to severe and can be associated with emotion dysregulation or cognitive impairments. Some forms of depression are slightly different or they may develop under unique circumstances, such as major depressive disorders. Depression can happen at any age, but commonly appears during the late teens to mid-20s. It affects an estimate of 1 in 15 adults, and 1 in 6 people will experience depression at some time in their life. Women are twice more likely than men to experience depression. Actually, this is the reason why we're focusing women on this research. And there's various reasons why this occurs. Number one is that women biologically experience more hormonal fluctuations during their development, during their growth. But at the same time, unfortunately, a lot of social stigmas and a lot of social oppression has caused that women experience highly stressed situations and highly stressed environments. And this stress can then lead to feeling, sad or guilty, impotent, etc. That all of this may cause depression. One third of women will experience a major depressive episode in their lifetime. And this is a very terrifying, but at the same time, important statistic to point out. Cortisol is a steroid hormone produced in the adrenal cortex. It affects almost every organ and tissue in your body and plays a role in multiple biological functions, such as response to stress. Elevated cortisol levels are associated with depressive disorders. Cortisol levels differ between patients with depression and healthy controls. As a matter of fact, patients with depression or depressive disorders have higher levels of cortisol than healthy controls. And women with depressive disorders experience cortisol insensitivity. And what that means, in order to explain cortisol insensitivity, I have to mention that cortisol is a hormone that does what is called negative feedback. And to explain negative feedback, we will have to analyze this figure on the right, which is an example of what is called the HPA axis or the axis or system that produces cortisol. Like we mentioned before, it is activated due to stress. It all starts in the hypothalamus with the production of the CRF hormone that manifests itself in the pituitary gland, activating or inducing the production of ACTH, which then manifests itself in the adrenal cortex, producing cortisol. And cortisol, the negative feedback means that its own levels control its production. So when the body reaches a certain balance or certain levels, ideal levels, of course, it will shut down production in two main areas, one being in the hypothalamus, and of course, another one being in the pituitary gland. White matter refers to areas located in the deeper tissues of the brain. Fractional anisotropy is a measurement frequently used in diffusion tensor imaging studies to measure white matter integrity. Patients with depressive disorders have more fractional anisotropy dysregulation in comparison to healthy controls. For the methodology, we will be measuring depression severity using the self-administered Beck Depression Inventory. The BDI is a 21-item rating inventory that measures characteristics, attitudes, and symptoms of depression. And here we have what I like to call an example of the results of the BDI. Here we have the raw scores, and as you can see, all of these raw scores, all these range of scores indicate a depression severity going from minimal all the way to severe. Salivary cortisol will be measured following the instructions provided by Alina Health Laboratories, or in the very least, using the Alina Health Laboratories. Instructions are a very important or useful guideline. This is because it's extremely easy to use, very straightforward. As you can see, it indicates what to do before you collect a sample, how to collect a sample, and what to do after you have collected the sample. To determine the neurocorrelates, we will use a magnetic resonance image, or MRI, to acquire diffusion-weighted images that will show us or allow us to analyze the white matter tracts in the brain. We will then process these images using DTI, which will allow us or will calculate us a whole brain fractional anisotropy map. Then we will implement tract-based spatial statistics, or TBSS, using BDI and cortisol levels in a general linear model. For our expected results, we have to go back to our hypothesis. First of all, women with depressive disorders experience cortisol insensitivity. Patients with depression have higher levels of cortisol than healthy controls, and patients with depressive disorders experience fractional anisotropy dysregulation in comparison to healthy controls. So we expect to see that patients with severe depression will have higher cortisol levels and more fractional anisotropy dysregulation than healthy controls, and patients with less severe depressive disorders. In conclusion, depression is among the most treatable of mental disorders, but unfortunately, approximately 10 to 20% of patients don't respond well to present-day treatments or don't respond at all. This study will show the brain regions affected by the severity of the depression and cortisol levels. And our research should shed light on the relationship between depression severity, cortisol levels, and white matter integrity in women, providing insights into the mechanisms of depression to potentially help untreatable patients. I would like to thank Ms. Charlene Rivera Bonet, my mentor, Dr. Abercrombie, our PI, Dr. Atchison, and Ms. Melissa Hyman for being the coordinators of the BPNP Summer Program 2020, the program in which I participated at Michigan State University. And this project proposal actually occurred during that program. The University of Wisconsin-Madison, the University of Dr. Abercrombie, and Ms. Charlene Rivera Bonet, and of course, the University of Puerto Rico at Cayey, especially the RISE program, for allowing me this amazing opportunity. Thank you for your attention. If you have any questions, I will be answering them at this precise moment.